Our topic for today is dosage calculations. First thing for nurses to know are the different measurements conversions. Drug dosage calculations are required when the amount of medication ordered or they decide is different from what is available on hand for the nurse to administer. So the formula is amount desired divided by the amount on hand times the quantity. The quantity is equivalent to 1 since the amount of medication available is specified per one tablet. Example: metoprolol 50 mg is ordered. Metoprolol is available as 100 mg per tablet. How many tablets would the nurse administer? First, we determine that the amount desired is 50 mg and the amount on hand is 100 mg and the quantity is 1. So 50 mg divided by the amount on hand, which is 100 mg times 1. So the nurse would administer zero point 0.5 mg of tablet or 1/2 tablet metoprolol to the patient. Another example. Phenytoin is available as 125 mg per 5 ml. Phenytoin 0.3 gram PO is ordered. How much should the nurse administer to the patient? First, we determine that the amount desired is zero point 0.3 gram and the amount on hand is 125 mg and the quantity is 5 ml. So we convert zero point 0.3 gram to milligram since the ordered dose is in grams but the drug is available on hand in milligram. So 0.3 gram times 1000 milligram divided by 1 gram is equivalent to 300 milligram. Then we divide the amount desired, which is 300 milligram, with the amount on hand, which is 125 milligram, multiplied by the quantity of 5 ml. So the nurse would administer 12 ml of phenytoin. Another example. Furosemide is available as 40 mg in 1 ml. 10 mg is ordered to be administered through an IV. What amount of furosemide should the nurse administer? First, we determine that the amount desired is 10 mg. The amount on hand is 40 mg, with 1 ml as the quantity. So we divide 10 mg with 40 mg times 1 ml. So the nurse should administer zero point 0.4 ml of furosemide. So dosage calculations based on body weight are required when the dosage ordered and administered is dependent on the weight. For example, many pediatric drugs are ordered and given per weight, usually in kilograms. So, for the stage 1, using the formula below, we calculate the total required dosage based on a given body weight. So weight in kilogram times the dosage ordered per kilogram. Then we apply the desired divided by the on hand times the quantity formula to calculate the amount of medication to be administered. So for the example, metaprednisolone 4 mg per kilogram is ordered for a child weighing 64.8 pounds. It is available as 500 mg per 4 ml. How many milliliters of medication must the nurse administer? So we determine that the weight is 64.8 pounds, the dosage ordered is 4 mg per kilogram, and the available on hand is 500 mg per 4 ml. Next is to convert 64.5 pounds to kilogram. So 64.8 pounds divided by 2.2 pounds per kilogram, so the patient's weight is 29.45 kilograms. Then we calculate the required dosage in milligram medication based on the child's weight. So the child's weight is 29.45 kilogram times 4 milligram per kilogram, which is the dosage order, is equivalent to 117.8 milligram. Then we calculate the volume of medication in ml to be administered based on what's available on hand. So the amount desired is 117.8 milligram divided by 500 milligram times 4 ml. So the nurse must administer 0.942 ml of medication or 1 ml of methylprednisolone for the patient. Another example, the attending physician prescribes 250 mg of cefuroxime to be taken by a 20.5-pound infant every 8 hours. The medication label indicates that 75 to 150 mg per kilogram per day is the desired dosage range. So what's the doctor's order within the desired range? So we determine that the weight of the patient is 20.5 pounds, the dosage ordered is 250 mg, and the desired range is 75 to 150 mg per kilogram. And so we convert 20.5 pounds to kilogram, so it's equivalent to 9.32 kilogram. Next is to calculate a minimum and maximum dosage for a 9.32 kilogram infant. So for the minimum dosage, the weight of the patient is 9.32 times 75 is 699 milligram. For the maximum dosage, the weight times 150 milligram per kilogram is 1,398 milligram. Then we calculate the amount of medication the doctor has ordered for 1 day or 24 hours. So in 1 day, it is equivalent to 3 8-hour shift. So the doctor has ordered the medication to be given 3 times per day. So every dose is 250 milligram. So 250 milligram times 3 is equivalent to 750 milligram. So therefore, the doctor has ordered 750 milligram of medication per day. So we compare the total amount of medication ordered for 1 day to the dosage range listed on the medication label. So 750 milligram is within the desired range of 699 milligram to 1,398 milligram. So the doctor has ordered the dosage within the desired range. Now for the calculation of intravenous drip rates, here is the formula. The volume in ml divided by the time in minutes times the drop factor. Example, we calculate the IV flow rate for 250 ml of 0.5% dextrose to be administered over 150 minutes. The infusion set has a drop factor of 30 drops per ml. So we determine that the volume is 250 ml and the time is 180 minutes. So we use the formula to calculate the IV flow rate. So remember to round the final answer to the nearest whole number. So the volume is 250 ml divided by the 180 minutes times 30, which is the drops per ml. So the IV flow rate for our patient is 41.6 run up to 42 drops per minute. Another example, the infusion set is adjusted for drop factor of 15 drops per ml. Calculate the IV flow rate if 1,500 ml of IV saline is ordered to be infused over 12 hours. So we determine the volume is 1,500 ml and the time is 12 hours and the drop factor is 15 drops per ml. And we convert 12 hours, so that is a typographical error. So to convert 12 hours to 30 minutes. So 12 hours times 60 minutes per hour is equivalent to 720 minutes. And we use the formula. The volume is 1,500 ml divided by the time used is 720 minutes. And the drop factor is 15 grams per ml. The ideal flow rate is 31.25 grams per minute. And now for the calculation of flow rate for an infusion pump. So infusion pumps do not have a calibrated drop factor. The flow rate depends on the volume of fluid ordered and the time of infusion. So the formula for this is that the volume in ml over time in hour. So that would be the flow rate in ml per hour. Example, 1,200 ml B5 water IV is ordered to infuse in 10 hours by infusion pump. Calculate the flow rate in milliliters per hour. So first, we determine that the volume is 1,200 ml and the time is 10 hours. Since the volume is given in ml and the time is given in hours, the flow rate can be calculated in one step. So the volume divided by the time. So 1,200 ml divided by 10 hours is equivalent to 120 ml per hour. So the IV flow rate is 120 ml per hour. Another example, 600 ml of antibiotic is to be infused over the 180 minutes by infusion pump. Calculate the flow rate in ml per hour. So we determine that the volume is 600 ml and the time is 180 minutes. So we convert 180 minutes into hours. So 180 minutes divided by 60 minutes per hour is equivalent to 3 hours. And we calculate the flow rate in ml per hour using the formula. So 600 ml, which is the volume, divided by the 3 hours, which is the time, is equivalent to 200 ml. So the flow rate is 200 ml per hour. And thank you for watching.